Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
Psychiatry versus primary care for mental health. When to seek a specialist. A lot of people feel stuck before they ever get help, not because they don't want care, but because they don't know where to start. Do you call your primary care doctor? Or do you go straight to a psychiatrist? That uncertainty alone can delay care for weeks. So today we're breaking down what primary care can handle, when psychiatry becomes important, and how clinicians decide to step care up. Because the right starting point isn't about guessing. It's about matching the level of support to what you're experiencing. Primary care, the front door to mental health. For most people, mental health care starts in primary care. And that's not theory. That's what actually happens in real life. Large U.S. health data shows that mental health concerns show up in the same clinics people use for everyday care. Things like depression, anxiety, sleep problems, stress, substance use concerns. A primary care clinician can screen for depression and anxiety, ask about sleep, energy, and stress, start first-line medications when appropriate, and track how you respond over time. They're also looking at your whole health, not just mood. When symptoms are mild to moderate and respond to initial treatment, that continuity can be exactly what someone needs. Primary care also plays a gatekeeper role. They're often the first to notice when something doesn't fit a simple pattern and needs more specialized evaluation. When psychiatry becomes important, sometimes the picture gets more complex. That's when psychiatry steps in. Not because primary care failed, but because the situation requires deeper diagnostic precision and more specialized treatment planning. Psychiatric evaluation becomes especially important when clinicians see possible mania or psychosis, high-risk suicidal thinking, overlapping conditions that blur together, treatment that isn't working despite good follow-through, medication plans that need closer monitoring. At that point, the center of gravity shifts. A psychiatrist is trained to differentiate complex diagnoses, manage multi-medication strategies, monitor side effects and risk more closely, and adjust treatment in a more nuanced way. The real differences. Think of it this way. Primary care. Broad, whole-person focus. First-line medications. Ongoing monitoring. Best for mild to moderate symptoms. Psychiatry. Diagnostic precision. Complex medication management. Risk assessment. Best for severe, unclear, or treatment-resistant symptoms. It's not either-or. It's stepped care. Signs you may need a psychiatric evaluation. Clinicians usually escalate care for practical reasons. Your symptoms stay intense. Your diagnosis isn't clear. Your current treatment isn't working. Medication management becomes complicated. Safety concerns appear. Or you need specialized therapy pathways. That shift isn't a setback. It's matching the care level to the need. The collaborative care model. The best outcomes often don't come from choosing one lane forever. They come from team-based care. In collaborative care models, primary care stays your anchor. Psychiatry supports the complex parts. Care managers track symptoms over time, and adjustments happen quickly. In one program, patients with moderate depression and anxiety saw about a 5-point drop on depression scores, about a 6-point drop on anxiety scores, and even larger improvements among those who completed the program. That's not a miracle, it's coordination. Where should you start? If you're unsure, the safest and most accessible first step is often primary care. They can screen, start treatment, and monitor how things change. But you don't have to wait until things feel unbearable to see psychiatry. If your symptoms are severe, unclear, or not improving, specialized care can give you a more precise plan sooner. At Zeam, we connect primary care and psychiatric services in one team, so you don't have to guess which door to knock on. The goal isn't to pick the right provider on the first try. The goal is to get into care and then step up support when needed. If you're feeling stuck or unsure where to begin, reach out for an evaluation and we'll help match you to the right level of care. Next time, we're talking about something that comes up a lot after people start feeling better. Why some patients need ongoing psychiatric care after stabilization. We'll cover why improvement doesn't always mean discharge, how relapse prevention works, and when long-term psychiatric follow-up makes sense. Thanks for listening, and we'll see you next episode.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.